Hi, I'm Dr. Richardson. I'm hand surgeon with Granite Orthopaedics. So, carpal tunnel syndrome is an issue with a nerve that runs through our wrist area. That wrist area is called the carpal tunnel. That area is made up of the bones of our wrist and then a small band of tissue called the transverse carpal ligament. Those two structures together create a tunnel through which run the 9 tendons that move our fingers and one nerve. That nerve is called our median nerve, and it gives sensation or feeling to our thumb, our index, and our middle finger. And when the nerve doesn't have enough room as it's going through that tunnel with all the other structures, it actually starts to make your fingers feel numb and tingly. And so carpal tunnel syndrome is the sensation of having that numbness and tingling in those 3 fingers. So carpal tunnel syndrome is actually diagnosed a few different ways. Some of it is the history, meaning how a patient would feel when they're describing their symptoms, if it's happening at night, waking them up from sleeping, which fingers are involved. So it should be your thumb, index, middle finger that are going numb to have the diagnosis. We also often will order some other testing. That testing is called an EMG or an electromyograph test. The electromyograph will test how quickly your nerve conducts electricity, as well as how your nerves are communicating with the muscles in your hand. Sometimes we'll also use an ultrasound in the office to be able to look at the size of the nerve. We can measure the circumference of the nerve, and that will sometimes give us some clues as well as to the diagnosis. But mostly it's history and then the EMG test. So, as far as carpal tunnel syndrome goes and conservative treatment options, the issue comes down to the fact that our carpal tunnel is not big enough to house the contents that pass through it, meaning that all of the tendons that run through our carpal tunnel, along with the median nerve, uh, that situation creates pressure on the nerve, which decreases the amount of blood flow that can go through the tiny little blood vessels that live in the median nerve. And so when that happens, we start to get numbness and tingling in our fingers. And there's not a great conservative way to make that not happen. Oftentimes, if it's a mild situation, meaning that a patient has maybe 1 or 2 times a month symptoms of numbness and tingling in their hand, we'll ask them to wear a wrist brace when they sleep at night. That stops them from basically kinking the nerve or causing the nerve to take a path through their carpal tunnel that would create more pressure. When we do that, that allows that nerve to have normal blood flow or near normal blood flow and then less symptoms. So we'll often do that for a long period of time until maybe your symptoms worsen, and then we would pursue other avenues of treatment. But sometimes the conservative thing to do is actually have surgery. And so having a surgery basically recalibrates the size of the carpal tunnel and makes it so that your nerve can pass through there without having the excessive pressure on it anymore. As far as treatment goes, that is the only way to change the anatomy of the carpal tunnel or make it so that as your nerve passes through this area, there's not pressure on the nerve creating decreases in blood flow in the nerve itself. I tell people that there's good literature that says that if you're waking up 3 to 4 times a week with a numb hand, that's a fixable problem. Sleep is such an important part of our lives that if we can correct something with a 5-minute surgery, that's usually the best bet. That's usually the best thing to do is to go ahead and have your carpal tunnel released. So surgery for carpal tunnel syndrome entails making what we call a mini open incision in your palm. It's right at the base of your palm. It's about an inch long usually. We usually do that under a local anesthetic, meaning that you don't go to sleep or have a general anesthesia for that, but rather a shot of lidocaine or another anesthetic to numb up the surgical area. From there, we go to the operating room. You're awake when this happens. Don't worry, you can't see anything. We make everything sterile and use sterile drapes with a drape in between you and me, the surgeon. The surgery, though, takes about 5 minutes where we go down and divide the transverse carpal ligament, which is the culprit in this scenario. And then once that's done, you get about 3 stitches, a bandage, and you're done. You can usually drive yourself there and drive yourself home, eat breakfast the day of surgery, and most often pain afterwards is pretty minimal. You will get a few pain medications to take just in case, but most likely Tylenol and ibuprofen are enough for pain control afterwards. So some of the long-term concerns that can occur with carpal tunnel syndrome come down to what happens when your nerve essentially atrophies away. And what that can do is give you permanent numbness and tingling in your first three fingers, in your thumb, index, and middle finger. And it can actually cause the muscle that goes to your thumb to atrophy to a point that it's difficult to oppose your thumb or get your thumb to touch the tips of your fingers. And so those changes generally take many decades to occur, but if it goes untreated for long enough, that certainly can be the outcome. All right, thanks for listening about carpal tunnel. As usual, you guys know what you're supposed to do. You're supposed to hit like and subscribe. You can follow our channel and go to our website for more videos like this as well. And of course, if you have any other questions and want to talk in person, come by the office and make an appointment, and we can talk more about carpal tunnel syndrome. Thanks.